Hello, welcome to my channel. Today we'll be talking about ulcer. Ulcer. Sometimes you will notice some burning sensation in your stomach lining, some kind of pain, loss of appetite, feeling nausea. These are some of the symptoms. That doesn't mean that anytime you have any of these the symptoms, you automatically have a ulcer. You could just be having a high acidity. Sometimes when there is efflux of acid, stomach acid, when there is efflux, when it comes up towards the esophageal area, you tend to have heartburn. Is a sign, but not really the ulcer. What is ulcer? Ulcer is simply a wound or sore at the lining of the intestine, the mucosal lining of the intestine. This is the protective cover of the intestine. When there is a wound on it and over the time the wound continue to deepen. And there are so many things that can cause this. Number one is when there is a presence of a particular kind of bacteria known as H. pylori. When this bacteria is present in the intestine, in the abdominal region, it causes high acidity. Waste products from this worm is highly acidic, thereby leading to ulcer. Another cause is excessive intake of alcohol. Alcohol is a preservative. We know that alcohol affects the function of certain enzymes in the body. So when you continue to consume this alcohol over the time, it can lead to ulcer. Another one is smoking. Yes, smoking also leads to ulcer. Then when there is hyperacidity in the lining of in the stomach, we all know that we have certain enzymes that helps in digestion of food that we take. Without these enzymes, without their presence and their activeness, that you will be having indigestion. That means when you eat, the food will not be able to digest. But when these acids are being stimulated without them having any work to perform, they will in turn start digesting the walls of the intestine. That's why you always advise not to be chewing anything like bubble gum on an empty stomach, or perceiving cooked food for a long time when there is no available food for you to eat. It's always advisable because our brain is very sensitive, very active, that once you perceive good cooked food, it sends signals. These enzymes are activated, waiting for the food to enter so they can act on it and digest it. But when they did not see this food, what happens? They in turn start being harmful to the walls of the intestine, and this can also lead to ulcer. Then another thing that can lead to ulcer is regular use of painkillers. Some like self-medication. Once they are feeling pain, next thing painkiller. When you take all this unprescribed regularly, it can also increase the acidic level of the stomach and intestine. This can also lead to ulcer. In order to prevent this, you have to reduce your intake of alcohol, reduce or stop smoking, treat make sure that you eradicate the H. pylori, the Helicobacter pylori in the stomach. Reduce your intake of painkillers. Make sure that before you take any painkiller, it's being prescribed by a doctor. Don't just buy and start swallowing it. No, it's not advisable. Before you can say you have ulcer, it's not, like I said before, it's not because your stomach is paining, you feel one stomach upset, you conclude that you have ulcer, then you start treating yourself. No, please go to hospital. Let the medical practitioners do their work. Go for a lab, run a test, so that you can also know if actually you have the ulcer. You can also know the cause and know how you can go about treating it. But there are some preventive measures you can take. Always eat balanced diet. Very important. Eat on time. Eat when you're supposed to eat. Although hunger does not cause ulcer like people believe. People always believe that starvation causes ulcer, hunger causes ulcer. No, it does not cause ulcer, but your lifestyle, the activities you do when you're hungry. So when you're on an empty stomach, you are still stressing yourself, and you are perceiving cooked food, or your mouth is busy, you're chewing gum. So all this can lead to ulcer. Let's stay healthy. Let's take care of ourselves in every possible way. Please, always take care of yourself. Pay attention to your health, because health is wealth. Some symptoms of ulcers: burning stomach pain. When you are having pains, burning stomach pain, and this pain dey worsen over time. Then bloating. Most times your stomach is big, feeling of vomit, like you want to throw up. Most loss of appetite, another symptom. Then in severe cases, when the degree of the ulcer, the degree of the wound has gone deeper, you can see blood in the stool or black stool. Don't allow yourself to get to this point before you seek for help. Please don't. Ulcer is common. It's very, very severe, but it's treatable. It's treatable. Certain foods that can lead to ulcer, or that can trigger it for people that is already existing in their system. Number one is spicy food. Any food that has that is too spicy. A lot of us like it pepperish, but if you have ulcer, I have a bad news for you. You have to stop it, reduce it, because it triggers it. But let's think of it. Imagine a wound on your skin and you apply pepper to it. Do you think the pepper will help it to heal? Of course not. So anybody that have ulcer, you have to run away to excessive spicy food. Then caffeine and coffee. Caffeinated drinks, coffee, it wasn't the ulcer. So I'm sorry, but you have to you have to reduce it, or if possible stop it. Then alcohol. Alcohol is a preservative. Normally alcohol is being used to preserve tissue. When you keep taking alcohol in an excessive manner, it increases the acidic level of the stomach, and once this is done, it in turn cause more harm. It in turn deepen the wound. So you have to do away with alcohol or reduce it. Take it once in a while. Of course, no more smoking. Another one is carbonated drinks. How many people are guilty of this? A lot of us like to wash down our meal with carbonated drinks. If you have ulcer, it's time to stop. You have to let go. Then fried or fatty foods. Our fries, we like everything fried. It's time to reduce it. Instead of frying it, let's do steaming. baking. Yes, all those food that you like to fry, please switch to baked food, steam food. Do other thing. You can steam your stew. Do other things, but leave fried food. You must not fry your chicken. You can bake it, you can steam, you can do any other way, but please. Then chocolate. Did I hurt your feelings now by mentioning chocolate? Yeah, you have to reduce your consumption of chocolate. Then citrus, our dear oranges, our dear tangerine. You have to reduce it because it's highly acidic. You have to reduce it. You can take other fruits that and veggies that are not acidic, like watermelon, banana. Another food is tomatoes, tomato based products, ketchup, tomato sauce. Tomatoes, they are highly acidic and they can trigger ulcer. If possible, improvise. Then processed meats, our sausages. Those who cannot do without sausage, we want to cook our any food, we'll garnish it with sausages. It's time to let go. Bacon and other processed meats. Any processed meat, it's highly salty. It contains high salt and preservative, which it irritates the lining of the stomach. And the next one is peppermint. Peppermint, most times we like to lick it to keep our mouth refreshed, but the sad news, it's time to stop. It's time to let it go. So please, it is not easy. Yes, it is not easy, but in order to go through this journey, if you want your ulcer to heal, you need to be disciplined. Let go of all this. Let go of all the certain food. There are many more things, many more foods, but these ones basically, you have to let it go, at least for the meantime, until your healing is complete. Find out the cause and the site of the ulcer. Take your medication religiously, and by God's grace, it will heal. It will heal. Have you ever noticed any food or any drink or anything that once you do, it triggers your ulcer? You start feeling the pains again or intensively? Please share with us. I'll be waiting for you in my comment section. Do you find this helpful? Please share this post to somebody who might need it, and comment if there is any sickness or any medical condition, any topic pertaining health that you want us to talk about. Comment in the comment section. Please subscribe, share, like. Thank you. For more details on this ulcer, I wrote an article on celestinaluxury.wordpress.com. You can click on it to get more details. There I discuss some other diseases and other things. Thank you.